Thank you everyone for joining us. So we are about to start. I am going to hand over this meeting to Ben Omilo from East African Child Rights Network.
Okay, thank you, Jenny, and thank you, everyone. I'm Benedict Omilo from the East African Child Rights Network. Apparently, I'll be putting on my video later, but not now. Apologies for that, because of where I'm presenting from. I welcome all the East African child rights workers, colleagues, networks, and the children of Eastern Africa for this training. This is the second day of this training. Yesterday we were in the Southern Africa, and today we are here in Eastern Africa, and I welcome us all. Perhaps, Jenny, if you'll allow that people make a few introduction for the sake of just understanding who is in the house and from which organization and country. So as I said, I'm Benedict Omilo from Kenya. I work with the East African Child Rights Network. We co-host the CSO Forum, and the CSO Forum is the coordinating forum for these trainings that we are supported by AfECN, who will be our trainers also. So welcome on board, everyone. And Jenny, please, as your order, according to how people appear on the screen and the order, kindly allow them to introduce themselves in a few. Thank you, if that is in order.
Sorry, Ben, I don't think we have time for that because of time. We have very short time, and we have a lot of work. So I think we'll just move on to the opening remarks.
Okay, thank you. Thank you for that guidance. As I said, that from the East African Child Rights Network, it is a network of child rights organizations from Eastern Africa. And we are headed by a management committee. And at this juncture, I'll welcome the chair of the Eastern Africa Child Rights Network, Mr. Damon Wamara Kamase from Uganda, who will give the opening remarks as we start this training. Thank you. Well,
Thank you very much, Ben, and good morning to each and every one of you from Uganda. My name, as mentioned, is Damon Wamara, and I'm the chairperson for the Eastern Africa Child Rights Network. At the same time, I also am the executive director of Uganda Child Rights NGO Network. I am glad to be on this call, and I want to warmly welcome each and every one of you. Thank you all for joining into this call. Thank you, ACRWC Secretariat and the CSO Forum for organizing this conversation. It's very key for us to talk about and to understand how we can engage with the early childhood centers, especially after this pandemic and everything that is happening around us. In Uganda, personally, we have seen that the ECD centers have been asked not to open until further notice. And in Kenya, we know that there's been a lockdown number 2 with some counties being locked down and children have returned home. And in different other countries, different circumstances as they're faced. But how can we continue engaging? We all know how important ECD centers are. We know why it is virtual and very, very crucial for us to continue seeing ECD centers operate. How can we do this? I'm anxious for us to learn, and I'm anxious for us to engage on it. And I want to thank UNICEF, AfECN, EC, and all the members who have organized this conversation. Thank you very much for bringing us together. And I want to welcome all members to please be alert, and let's learn, and let's also engage and be able to share with our different organizations at our country level and different other stakeholders. Thank you once again, and please enjoy the 2-3 hours of engagement. Thank you. Over to you, Ben.
okay, thank you, Chairman. And thanks for your wise words. And actually, indeed, the early childhood development is an issue that every child rights actor should be much concerned, and especially at this time when we are faced by this pandemic, where schools are being closed, others indefinitely, like in Nairobi and some counties bordering Nairobi, the schools are closed indefinitely, and others exams are going on. So you find that the situation is quite unfortunate at this time, and this workshop actually comes at a very opportune time. In this training, we are going to have 2 sessions, the morning session and the afternoon session. And I'm having challenges with my laptop opening the program. Jenny, have you opened the program so that you can take us through briefly as we introduce the trainers? Thank you.
Thank you so much, Ben. Our next session is a short video. Those ones who join on time, you probably saw the video playing. So I'm going to ask Alicia to just speak a little bit about the video and just introduce the video. Alicia?
Thank you very much. Hello, good morning.
Go ahead, Alicia. Go ahead, Alicia.
Okay. Sorry, I was having some technical difficulties. Yes, my name is Alicia Lutomia from the Africa Early Childhood Network. I'm a Program Center Administration Assistant Officer. And I'm going to be introducing our presenters and facilitators for the day. First, we have Maniza and Tekim, who is the Early Childhood Development Regional Advisor from UNICEF SRO. And Maniza was the Senior Program Officer at the Open Society Foundations and has worked as a policy advisor and advocate for the CIF, Amnesty International UK, and the Confederation of British Industry in the UK. She was a consultant for Save the Children UK, UNESCO, Oxford Policy Management, and DFID. She holds a Master's in International Politics from the School of Oriental and African Studies, University of London, and a BA in Philosophy, Politics, and Economics from the University of Oxford. Next, we have Dr. Tishome Desta Wuldehana from the WHO Intercounty Support Team from Harare, Zimbabwe. Dr. Tishome is the Head Family and Reproductive Health Cluster Medical Officer for the Child and Adolescent Health for East and Southern Africa. He's a medical doctor and specialist in pediatrics and child health, 35 years of medical and public health service in child and adolescent health in the region. He is supporting 20 countries in developing and implementing child and adolescent health policies, strategies, and plans, including early childhood development. Next, we have Caroline Dusabe, who is the ECCD Senior Specialist at Save the Children Rwanda. Caroline Dusabe is currently providing ECCD technical support in Sub-Saharan Africa and has over 12 years experience in early literacy and ECD. A teacher by profession, Caroline is also a published author of children's books, co-author of 2 peer-reviewed journals, and various research reports. She's a co-convener of the Quality ECD Working Group of the African Union CSR ECD Cluster, and was the 2016-2017 chair of Rwanda Education NGOs Coordination Platform, and won the CEO Globals in 2016-2017 Africa's Most Influential Women in Business and Government Country Level Award Education category for her work in Rwanda education sector. Excuse me. Next, we have Patricia Martin, who is the director at Advocacy Aid South Africa. Patricia holds a Master of Law from the University of Cape Town and has been a child rights advocate for 20 years. She has extensive experience in early childhood systems, strengthening policy development and advocacy, as well as support to development partners across Africa, including UNICEF, Save the Children, MIT Africa, SADC, and the African Child Policy Forum, Orbis Africa, as well as the Center for Child Law and others. So these are our presenters and those are their bios. Thank you very much. Over to you, Chair.
Thank you, Alicia. Next is the video by the advocacy video by AfECN. Thank you, Dedan. So I'm going to invite Maniza from UNICEF to give us what I want to call ECD 101 to help us understand ECD, just the basics of ECD, why it is important and why it is important to invest in it. Maniza?
Thank you very much. And good morning, colleagues. I hope that this training session and meeting finds you well today. I just put on my video so you can see me. I feel like I'm at home speaking with my brothers and sisters at home because I'm based in Nairobi, and part of the region I cover is East Africa. So I'm really pleased to be here with you today. I'm just going to share my screen. Oh, it says the host has disabled. Does someone mind allowing me to share screen? Let me know when that's done. So colleagues, I want to first of all start off by thanking the CSO Forum for convening this meeting today, and in fact the series of meeting over the next yesterday and tomorrow as well, for us to discuss early childhood. And I also want to thank our great partners at the African Early Childhood Network, AfECN, for also helping us to come together and convening us and helping to run things technically. So really pleased to be with you here today. I'm just going to share my screen. Hopefully you can see. If not, someone will let me know. So I'm going to do a couple of things today, and I don't want to take too much time. So the first is just to give you all a sense of what early childhood is, why it's important, thinking through a little bit some of the challenges we have in our continent and in the East region specifically, and then finally looking at some of the really positive trends we see both in the continent, at the country level, and at the global level too. So let me just start by explaining what the early childhood phase is. So we generally think of early childhood starting from conception through to the age of 8. So you can think of it as from pregnancy through to when a child typically leaves lower primary school, lower primary education. But we have 3 distinct phases within that. The first phase is birth to age 3, which contains the first 1,000 days and the period of most rapid brain development, which I'll come back to. Then we have the period typically age 3 to 6, where we see children entering into preschool, early childhood education. And then we have the latter phase, age 6 to 8, when we see children entering into primary school and completing their first 2 years of formal primary education. So those are the different phases of early childhood. Now, what is early childhood? And there's one point I want to make clear here, which is early childhood, ECD is not a thing. It's not a center, it's not a program, it's not a school. It's actually an outcome that we want to achieve for all our children. It's something we almost cannot touch, but we know it when we see it. And that is for our children to be physically healthy. This means that they're well nourished. This means that they have developed all the motor skills they need. This means that they are well. When they're sick, they're taken well care of. So they're really physically healthy and strong. The second is being emotionally secure. This means, and this is really important for the audience today, children feeling very safe, feeling very loved, feeling very secure. When they have this kind of emotional security, we know they're able to fly and do well. The third aspect is having children who are socially competent. This means able to play nicely with their peers, able to negotiate, able to express themselves, able to communicate well with their friends, with adults, and with anyone they come into contact with. And the last thing is it's about children being intellectually curious, wanting to learn, having a thirst for knowledge and learning, excuse me, which is something they hopefully carry forward with them all their life. So ECD is an outcome we want for children, and it contains all these different components. Now, we have 3 main cases that we use to make the case for early childhood development and an investment in the early years. We have the case from science, the case from economics, and the case from human development. And I'm going to go through each briefly. So here's the case from science, and it's very simple. The earliest years are the most rapid period for brain development in human beings. In fact, by the age of 3, 80% of the human brain is developed. By the age of 5, 90% is developed. So it means before a child even enters into primary school, into the classroom, their brain is already really advanced in terms of its development. And what this graph shows you is that development starts even while the baby is in utero, even while it's being carried by its mother. And so this is a really important point to raise in terms of the maternal health, both mentally and physically, as a woman is pregnant, and thinking about what impact that also has on the development of growth of a baby. And then, as you can see here, by the age of 3, some of the most critical skills, like being able to communicate, being able to control your emotions and control if you're feeling frustrated and sad, and articulate that, being able to make decisions and work well with others. These skills are developed at the height of their development is even by the age of 3. So really the scientific case for investing in the early years is irrefutable. And of course, conversely, that means that any child who experiences adverse conditions, poor nutrition, or they grow up in a home or household where there is abuse and violence and neglect, this can impact on their brain development and specifically impact on the neural connections that they make in their brains. And some of these neural connections, once they are ruptured or once they're not made, they can't be made again. So whilst we're not saying you give up on any child who hasn't had the best start in life, we are saying that the most efficient and effective way of ensuring children are developmentally on track and laying the foundation for education and learning starts if you invest in the early years and make sure children have the best environment to grow up with in the early years. And here is another graph or picture I like to show because I feel it's a picture that paints 1,000 words. On the left-hand side, you have a brain scan of a child aged 3 who has grown up in somewhat of a normal environment with some of the things I talked about before, the safety, the protection, the love, the good health, the good nutrition. And on the right is a child who's suffered from extreme neglect. So you can see that even by the age of 3, the sheer size of the brain and the neural connections are affected if a child has not had the best start in life. And you can see the adverse effects if they have not had the best start in life. So this really, again, emphasizes the importance of investment in the early years. The second argument is from economics, and I'm not going to go reading through the evidence on the right-hand side. The simple point is this. A Nobel laureate in 2000, James Heckman, did an analysis in 2006, and he found that the rate of return to investing is greatest when you invest in the early years. This means that in terms of having a more equitable society, in terms of distributing your resources, not just more equitably, but efficiently, it makes sense to invest mostly in the early years. And you see that the rate of return to society decreases as you invest in the later years. Now, this does not mean that government should not invest in primary schools, in secondary schools, in higher education. But it does mean we have to look a bit more strategically at how we allocate our scarce public resources and make sure that we don't miss out on investing in those vital early years. And then we have the case from human development from across the globe, and including from our region, recent studies emerging from our region, that children who receive a good start in life are more likely to stay in school and not drop out. They're more likely to master the basics of reading, writing, and counting. And we see them in later life having improved social outcomes. So having fewer children and children that they can take care of and support also for their own development. So we see this positive cycle, this virtual cycle when we invest in the early years. People less likely to be in prison, more likely to be able to economically contribute to their communities and their countries. So we see the real benefits of investing in early childhood having implications much later on in people's lives as well. So those are the cases for why we should invest in the early years. And then we come now to the challenges. So approximately 43% of all children in lower middle income countries are at risk of poor development due to poverty and stunting alone. This was the main finding from the Lancet series on ECD in 2016, and the Lancet is a very prestigious medical journal. You see in our region of sub-Saharan Africa, that number can go up to 2/3. And recent study I saw showed that in 3 countries, Kenya, Tanzania, and Mozambique, combined, that number can even go up to 75%. So whatever the number, we know one message, which is that too many of our children are developmentally off track. And of course, that means we all need to redouble our efforts to do something about that. This graph just shows you another challenge. I mentioned, and I showed you before, the Heckman graph, the Heckman curve that shows you the importance of investing in the early years. And here we have a graph where we have superimposed what donors spend their money on, but it's also what governments spend their money on. And you can see that even though the evidence says we should invest most in the early years, that's not what we do. We tend to invest later on. So one of our challenges is the lack of financial investment in the early years in supporting parents to make sure their children get the best start in life. The other challenges we have across our continent and across the region is there aren't affordable, scalable models that we can take to scale. There are many projects and programs doing great work, but how do we take them to a national level and impact on more children? We see that vulnerable children and family especially are not being able to access integrated services that they need to take care of families, to take care of parents, and to take care of children too. I have already alluded to the lack of sustainable financing, which is a real impediment. Also, there's a lack of a competent workforce across the board. And if you think about the really core job that we expect pre-primary teachers, community health workers, social welfare officers, nutrition counselors, and the like to provide to support young children, we often find this workforce not well remunerated, not part of an official professional structure, not well supervised, and maybe not also well respected. Yet they're doing what I would say is the most noble work. And the final thing is that we have a real real lack of data and measurement for us to know how well we're doing, where we need to stop, where we need to course correct, and what we can do to scale up what we know works. And now I come to the issue on some of the solutions and some of the responses that we are making. My colleague Teshome from WHO is going to take you in much greater detail through the nurturing care framework and idea. I'm not going to spend too much time. Suffice to make just one point, which is in order for children to develop fully, and you'll recall my first graph of what that meant physically, emotionally, etc., they need to have all these inputs. They need to be healthy and well nourished. But the really important thing for the audience today are these 2 parts in blue. They need to feel safe and secure, and they need to have parents who are well capacitated to provide them with the best environment. And that's where the CSO Forum, the work on child protection, and your sector becomes all the more important. We also need to take a more systems approach. And what this means, what this graph is showing you is that there is the health system, the social welfare system, and the education system with excellent touch points for children during those critical years of early development and their caregivers. The question really is, what can we do to create an enabling environment that enables all those contacts with young children and their caregivers to be exploited to their fullest so that children can be developmentally on track? And that's what we mean about taking the systems approach, and that's why the systems approach is so important. Some positive trends we're seeing in our region and globally, we're really seeing a growing appreciation and recognition of the importance of investing in the early years. At the global level, for the first time, we have an SDG indicator specifically calling on us to deliver for early childhood development. We're seeing donors and funders coming into this space. We're even seeing the group of 20 richest countries in the world identifying ECD as a core thing to invest in. In our continent, we're seeing this rise up the agenda. with the African Union really taking a lot more of a role and a lot more of an advocacy position to really call on further investments for young children. We see that also in the AU's, not just the Agenda 2063 with the aspirations, but even in some of the sector strategies and goals. Here, I've pulled out the Continental Education Strategy for Africa. But I would say most importantly is the work we're seeing at the country level, with ECD being included in national development plans across many countries. I mentioned a couple here, but in our region, across Rwanda, across Ethiopia, across Kenya, across Tanzania, many others, Uganda, policies to look at how we can ensure the development of children. And I would say this region is really at the forefront. We have also seen parents themselves wanting to invest more in young children. We've seen an explosion in the private provision of pre-primary education in places like Lagos and Nairobi, but also in places like Soweto and in Accra as well, and other major cities. We've seen strengthened partnership around early childhood. So active civil societies like you in many parts of our countries, really making the case for early childhood. And somehow the ECD sector is one of the most dependent on CSOs because they're the ones that are also providing some of the vital services. Of course, we've seen a real growth in the regional voice around early childhood, primarily because of the emergence of players and actors like the African ECD network. And finally, we see globally that there is an effort to combine and have a global movement, as we can see by the emergence of networks like the ECD Action Network, which is a global network for ECD. So a lot of information there. If there's just three things I want you to remember from my presentation today, it's these. First of all, Africa cannot meet any of its economic development security goals if it does not deliver for young children. Secondly, the key way for us to achieve scale is by supporting parents and parenting. I think parents are some of the most receptive people when they have young children in their household to really try and do what they think is the best for their young children. We are pushing at an open door. We have open people to work with. So what can we do to support them to do the best they can? The third point is that ECD is not somebody else's business. It's not about pre-primary. It's not about health. It's also about child protection. It's also about ensuring safety and security. And unless we plan together, but deliver on our sector accountabilities and hold each other to account, we won't be able to achieve that outcome of ECD. And then I'd like to close with one of my favorite quotes from Nelson Mandela. And I think it sums it all up here. Our children are our greatest treasure. They are our future. Those who abuse them tear at the fabric of our society and weaken our nation. I think we all agree. No one can put that better. Thank you.
Thank you so much, Maniza. That I know I've listened to this presentation the third time, and every time I get a new something. You know, every time, like the fact that CSOs are the leading people implementing ECD. That's something that we should, as CSOs, do something about it, because it's the role of the government to do something about ECD. You know, that should be an advocacy agenda. So next in line is Dr. Tishome. I don't know if he's in Addis or he's in Brazzaville, but he's going to introduce himself and what he does. Dr. Tishome.
Yeah, thank you. Good morning. I'm in Harare. And thank you very much. Very happy to join this discussion.
Go ahead, Dr. Tishome, and do your presentation.
Yeah, I'm going to share my... Yeah, thank you so much. Thank you very much. So I'll take you through a brief overview of the nurturing care framework and accompanying guidelines so that you have clarity what resources we have to support the implementation of the nurturing care framework to really promote early childhood development in our continent or sub-region. Yeah, this time we have really a unique convergence of science and political commitment for early childhood development. The Lancet journal, which is a reputable medical journal, has brought up key evidences that we have around early childhood development with the title Advancing Early Childhood Development from Science to Scale. So the Lancet has really synthesized available evidence, has also highlighted how we can really take the science into action and scale up ECD in a practical way. And the Sustainable Development Goal has put ECD at its center with clear targets. And the Global Strategy for Women's and Children's Adolescent Health is a means to translate the Sustainable Development Goals. So all these have put the nurturing care framework to support ECD at the center of all these global strategies and commitments. So we have now a better evidence, a better political commitment to really support early childhood development now than ever. If you look at the burden of suboptimal development in the globe, based on the latest Lancet estimates, we have at least 250 million children at risk of suboptimal development due to poverty and stunting alone. If you include other risk factors of suboptimal development, the numbers could be much higher than this. But it is important to note that about more than 80% of the countries with more than 60% of under 5 children at risk of suboptimal development are concentrated in the African region. You can see the Eastern Africa, they are shaded orange or red, no? I think more of orange. So you can see really the burden is concentrating in Africa, Eastern Africa, Southern Africa, and also West Africa. So we have a lot of homework to do. This slide conveys to you the miracle of human development. This process starts with the fertilization of the genetic materials, but the genetic materials in the fetus or the embryo establishes the broader development blocks. But what actually matters or defines is really the environment. The environment modifies the genetic blueprint during critical periods of development. What are really these critical periods? The critical periods are the pre-pregnancy, where the health and well-being of parents have a lot of influence on the development of the fetus. Pregnancy, the well-being of the pregnant mother influences how the fetus will be developing, and as well as the environment during infancy and childhood. So in summary, the quality of care we provide during these critical periods will have an effect, a lifelong effect in the health, education capacity, and productivity of that individual. And these effects are not limited to the current generation. It can pass on to the next generation. So it has a serious consequence. Now let's look at how the brain is built. Brain is built. Like I said, the neurons are developed while the baby is in utero in billions, but what makes it functional is a connection. We call them synapses. The connection is like electrical wiring. You can't have the bulb, you can't have the nice gadgets hanging in the on the ceiling and so on. But if you don't have the correct electrical wires, you cannot get electric light or electricity. So the connections are the most important things for the brain to function, for the nervous system to function. So during late pregnancy, you can see there are some synapse formation, but they are very thin. They are very thin until in the early years, in the early months of delivery. You can see the synapse formation is very thick during the 6 months and up to 2 years. And the synapse formation would be at astounding pace after birth, when the baby starts to sense his or her environment. The environmental stimulation is the most critical factor to determine the rate of synapse formation. So if you continue to stimulate the nerves, those who are stimulated would be reinforced, but those who are not stimulated would be considered useless. They will be considered redundant. So they will start to be eliminated. This is what we call synapse pruning after starting about 4 years. So the early stimulation is extremely important to build the brain, to reinforce the system. So this applies for most of the important brain functions. So that is why early stimulation is critical for brain development, whether it is language, whether it is visual, whether it is hearing, cognitive, social, and so on and so forth. So this slide shows you very nicely the window of opportunity, but which is very short. So if you look at the vision development, the white curve, and the hearing, the blue curve, and then and the various components, the velocity reaches at peak between like around 1 and 2 years. So after 2 years, the velocity of development starts to fall, to decline. So the first 3 years, 0 to 3 years, is the most critical window of opportunity to stimulate the optimal development of vision, hearing, language, but cognitive and so on, and the others will continue. But the first 3 years are really the most critical period to remember. This is where we need to invest a lot. So what are some of the risk factors that prevent children to develop to their full potential? Poverty is an important risk. Nutritional deficiencies, inadequate stimulation. This requires only awareness, knowledge. Otherwise, any family member will have the time to do that stimulation, interaction, smiling, playing with a baby. But this is an important intervention, but missing in our daily life in terms of providing support to our babies to develop to their full potential. Maternal depression is becoming a very important risk factor. It is becoming a big public health problem. Family stress, violence, child maltreatment, these are important risk factors that we need to address. However, we have also protective factors, protective influences. We have new evidence about this. Exclusive breastfeeding for 6 months and continuing breastfeeding for 2 years, even beyond, are important interventions to support brain development. Responsive caregiver-child interaction is an important intervention that we need to promote. And opportunities for young children to play and learn is extremely important. Maternal education is strongly associated with better developmental outcomes. Like Manisa was saying, the first 3 years is the best time of investment to get the highest return. You have seen from Manisa's slide that even the allocation of resources was the lowest. But this is area of the time of investment to get the highest return. So we have a role to play. And what is really the consequence of inaction? Poor early childhood development is associated with the following important points. Increased physical and mental illness in adulthood, about 1 year less achieved in schooling overall, and about 27% less average country annual income, and even more future economic loss for a country that can exceed the current GDP expenditure on health and education. You can see the implications of suboptimal development to an individual as well as to a nation. So this is a key area of investment. We have an iconic Jamaica study, which was an eye-opener and has laid the foundation. They looked at the nutritional supplementation and psychosocial stimulation on stunted children aged 9 to 24 months. This was an experimental intervention study. And they randomly allocated these children into a control group or a group that was given nutritional supplementation only, and another group who received psychosocial stimulation only, and the fourth group received both nutritional supplementation and stimulation. And these were matched with a comparison group of non-stunted children, and the finding was very interesting. So the red curve on top is for non-stunted children in terms of brain development quotient, looking at the various dimensions. The group of children who received both supplementation and stimulation were catching up in terms of development with non-stunted children. This was very good. But the children who received only stimulation also were performing better, but the children who received only nutritional stimulation were much lower than who received just psychosocial stimulation. And the lowest and the blue one is for the control. These are stunted children who have not received none of the interventions. So our interventions can make a huge difference, but when we combine interventions, we get a much better result, which is almost catching up with non-stunted children developmental quotient. So they followed up these children for up to 30 years, and they have documented that the groups that have received supplementation and stimulation have better academic achievement, a better employment opportunity, and a higher income, less violence, and they were involved in, less involved in aggressive or violent actions and so on. So it has shown a lot of benefit. So this is really one of the source of evidence to support the argument for strong investment in early years in ECD. Responsiveness also influences language development. The red curve is for children of highly responsive mothers, and the blue curve shows the trend for the language development of children of low responsive mothers. So let's briefly go through the nurturing care framework. The nurturing care framework was developed at the request of the WHO Secretariat to help countries with the programming of early childhood development, because ECD has been squarely as the center of SDG as well as a global strategy, but there was no clarity on how countries should go about ECD programming and service provision. So this framework was launched at the 31st World Health Assembly in May in 2018. And it's a roadmap that outlines why efforts must begin in the earliest years, from pregnancy to age 3, like Manisa was saying. And it also defines how nurturing care protects children from the worst effects of adversity. And it also gives guidance what caregivers need in order to provide nurturing care to their babies. And it also defines the roles and the responsibilities of the various sectors: education, Ministry of Health, social affairs, you name it. So what are really some of the guiding principles? The child's right to survive, development, and health. Leave no child behind. We want to have a universal coverage. And family-centered care is a very important principle and a whole of government action. This task is not just one ministry or one sector. It takes a whole of government action. It takes whole of society action. These are extremely important because no single sector can do it alone. So the vision and the strategic action areas of the framework are highlighted here. The vision is really to see every child to develop to his or her full developmental potential, leaving no one behind. And this strategic framework has 5 strategic action areas. Lead and invest. This is to ensure government leadership, ownership, and also funding. So it talks about governance. They need to set up a national multi-sectoral coordination mechanism and to develop or adopt a comprehensive national policy for ECD, and also to plan jointly with the concerned sectors and implement by sector, but monitor jointly. So there should be a multi-sectoral joint plan, but should be implemented by sector and should be monitored jointly. Financing is key. You have seen from Anisa's slide. You know, we should not depend on external support in the name of projects and so on, but government should establish a domestic budget line, whatever little it might be. That is a sign of commitment. The second strategic action area is focus on families and their communities. These are the foundation for ECD. So it is important to engage municipal, local leaders, communities, families in the planning and implementation of ECD activities. There should be accountability of communities, and they should hold also higher decision makers to account. And we need to also use mass media. We need to engage multimedia platforms to disseminate key ECD messages regularly, frequently. And the third strategic action area is really to strengthen the services. Manisa was emphasizing lack of appropriate model for scale up as one of the challenges. I think in reality, we need to use existing systems and services, build on what we have, build on the existing system packages, human resource, and so on. So it will be extremely important to integrate the components of nurturing care in the services provided, healthcare professionals, other frontline workers. We need to build capacity of the workforce to support the implementation of all components of nurturing care. We need to strengthen services so that both health services and social services would be provided to families and children who will need additional support, additional care. The fourth strategic action area is the monitor progress. She also mentioned about data and so on. So it is important really to integrate monitoring of children's development during routine counseling services in primary care facilities. It's important to monitor the implementation and use of data to adjust course of service and also interventions as you go along. And we need to invest also in a population level assessment and use data to strengthen programming. The WHO is leading the development of population-based indicators that are being piloted. I'm sure they will be available to be applied at population level. Use of data and innovate toward scale. We need to facilitate communities of practice for joint learning and document best practices and scale up effective interventions, proven interventions. We need to engage the private sector. We need to use digital solutions. We have to identify digital solutions to support program implementation. There are a lot of digital technologies, innovations to support ECD program implementation and blend with virtual communication, with other delivery approaches and strategies. So what are really the main domains of nurturing care? We have 5 domains or components: good health, adequate nutrition, responsive caregiving, security and safety, opportunities for early learning. We must support all these 5 components in order to support full realization of developmental potentials of children. So we need these 5 domains to be supported, plus we need enabling policies, we need strengthened services, we need to empower communities and also empower caregivers. So what are really the components of nurturing care? Like I said before, fortunately, a lot of the interventions that we have been implementing and are implementing to support child health, maternal health, are still important to support early childhood development. So what we need to do is to scale up the implementation of those interventions and add in missing elements. Nutrition, these are the interventions which are already ongoing in the current government or member states policies and strategies. Security and safety, we need to focus on some elements to strengthen, but birth registration has been started a long time ago, but when you look at the coverage, it's discouraging. It's very low in many countries. Safe water sanitation, it's a big problem. Good hygiene, clean environment, safe places for recreation, prevention of violence, social care. These are important ECD components. I'm not worried about nutrition, maternal. These are already ongoing, but we need just to boost. But I want you to pay attention to these two components. Early learning, responsive caregiving. These are the missing components. We are not implementing these. We don't even have any indicators to monitor our performance. So we have country profiles on ECD, but when it comes to responsive caregiving or early learning, you will see blank because we don't even have indicators to see how we are performing in these areas. But these are the things that we need to pay attention and make sure we integrate into existing services of various sectors. Enabling policies, supportive policies, and empowering communities. I don't want to go into the details, but I will share the PowerPoint. Otherwise, these are important elements to support and promote early childhood development. What are really the entry points we have for services? what are the entry points for nurturing care, to including responsive caregiving and early learning. This could be the health and nutrition, education, child protection, social protection, and this could be done in the form of home visits, group sessions, clinical services, child care services, or other platforms. Parenting interventions, I would like to emphasize the impacts are larger when both parents and children participate, and the impacts are larger when interventions involve modeling and practice of behavior. When it involves modeling and practice of good behavior. Children learn by seeing. So proper modeling is critical. So I just want to emphasize this will sum up what we have discussed. Responsive caregiving underpins all components of the nurturing care. Responsive caregiving connects all the other 4 components. It is a basis for recognizing and responding to illness. If the mother is watching, if the caregiver is watching, they will be able to recognize illness on time and seek care, appropriate care. And it is the basis for responsive feeding. The mother or the caregiver should watch for cues of hunger or baby looking for feeding. And it is the basis for protecting children against injury. And it is the base for building trust, social relationship, for building bonding, security, emotional well-being, and so on. So responsive caregiving is very important, but a missing element in our programming or services. So what are the available guidelines and tools we have to support the implementation of the nurturing care framework? We have a set of documents. Just to mention a few, WHO has released a guideline with clear recommendations on responsive caregiving and early learning in 2020. And we have also a nurturing care operational guidance, a handbook. This has a detailed account of how to do things for each of the 5 strategic action areas of the nurturing care framework. And there was an open consultation, which was just closed on 15 March. It's a live document, but will be an important guidance document to operationalize the nurturing care framework by countries. Operationalizing nurturing care for early childhood development is also another important guidance document, gives detailed guidance to countries on how to operationalize the framework. And the last one is strengthening nurturing care in health and nutrition services, a practice guide. This is a very practical guide, which is work in progress. I hope it will be finalized soon and will have a lot of value addition to support countries in the operationalization of the nurturing care in practical ways. So the nurturing care framework tools are in the nurturing care website. You'll find it here. It is accessible to the public. Just a few points about the nurturing care handbook. Like I said, it is composed of 6 guides or chapters. One is a general kind of introduction, and then there is a specific detailed guidance for each of the 5 strategic action areas. Very useful, very detailed. It's a living document with regular updates and supported by the nurturing care framework. You will find it in this website. So finally, I would like to emphasize that ECD is a child right. It's a basic child right, and it has a very high return of $17 US for every single dollar invested. Investing in early childhood development is a foundation for human capital development, national socio-economic growth and development. And you can see we cannot realize Agenda 2030 63 without investing in ECD, if the continent is going to realize its goals and objectives. Finally, investing in children is an investment in everyone's future. Thank you very much for your attention. Thank you. Over to you.
Thank you so much, Dr. Teshome. We can see your questions coming, guys. They are quick, fast and quick. Thank you so much. We can see the questions. Keep them coming. Keep the questions coming. Our panelists are here and they are ready to respond to your questions. Our next is Stella. Stella works for AfECN, but also supports the government of Kenya on issues to do with the nurturing care framework, actually. So she's going to present for us a presentation on parenting and early childhood. Stella?
Thank you so much, Jennifer and Dr. Teshome, for that very hearty discussion on investing in the early years. As introduced, my name is Stella Mbugwa, and today we'll be doing a child development session. And I'm very happy to be facilitating this on behalf of the AfECN family and also the team that has gone before me. So the global phenomenon of working parents reached Africa a while back. Mothers returning home, to work after giving birth, and dual income families where fathers and mothers have to work. So as a parent, who parents our children when we are working, whether we're employed or we're doing a small mama mboga business? And we cannot parent effectively without factoring in how the child is developing. And I think this is why I entered into the field of child development, to learn as a mother, but also to help other parents. Among the Nigerians, they tell us that a child who is carried on the back will not know how far the journey is. For me, I feel that we should parent with purpose, and we should determine the destinations we'd like our children to have. Any educator will tell you that they work with what they are given. So are parents being intentional about what they are doing at home before the child actually joins school? Self-control can be taught, yes. I have my own experience and I've seen it happen with others, even children that have developmental delays, they're having interventions and they have improved. And how do children learn? And how do people learn? It's an intricate interplay of nature, biology, and nurture, the environment, and that has been emphasized by our colleagues from WHO and also UNICEF. So people learn through brain development, and it starts right from the womb. The mind, that's wisdom of practice, but also spiritual heritage, and that is important for us here in Africa. Experiences, the nurturing, the richness of the stimulation from the environment has been emphasized by my colleagues. But many of us think that schooling is where learning starts. That's not true. Although schooling is also another way that you can sharpen whatever you have after you have left home as a young child. So a reflection that I would like us to have is, let's think about the first time a newborn tastes a lemon. They could be a day old, a couple of weeks old. So their taste buds burst with flavor, and this lemony taste makes the brain connections happen from one neuron to another. And with time and more lemon tasting or any other new taste for the child, it causes very strong connections to form. As the baby gets used to the taste, stronger connections are constructed in the brain and they will get used to this taste. That is learning. Colleagues talked about how the early years are bursting in neural connections and also synaptic pruning of every connections that are unused. And while others are strengthened, the neurons, the brain is able to function more effectively, and that's learning taking place. And as the brain is being shaped through these experiences, we have also learned that certain sensitive periods of development are mostly in the early years, the first 2 to 3 years and up to 5 years. And although the brain will slow down, we also have another very sensitive stage of development, which is adolescence. And brain scans of both an adolescent and a 2-year-old are similar. The neural connections are fewer, and it allows for different forms of shaping behavior and brain development. Probably for the teenager, it has to be faster, but we see that these are very sensitive stages of brain development. Different, but sensitive. So I'd like to illustrate a bit about the brain development across the life course. We know that at birth, if you take an orange, a quarter of it, that's how, if all factors are held constant and all is well with the mother and the baby, a child's brain has developed about 25% that of an adult size. And this is the same happens after they are born, about 65% increase in size. So at 3, the brain is at about 85% developed. So what does this tell us? The womb and in the home environment, the child, a lot of brain development is happening. And then at age 5, 90% is happening. So we may think that preschool should do a lot, but actually we should have done a lot of that, a lot of stimulating learning from the home and from the womb. Then after the age of 5, brain development in terms of size slows down, but of course there'll be lots of architectural changes that are happening. That only happens about 10% until death. So what are we saying? Out of an orange, 90% of brain development is happening when the children are very early. And an example would be, as an adult, if you try to learn a new language right now, and especially how they are pronouncing the words, it would be quite difficult. But for a 3 to 4-year-old, studies have been done, and they can easily learn up to 6 languages. They may not know this is Baganda, this is Swahili, this is Kikuyu, but they're able to speak fluently and learn up to 6 languages. Another African proverb about intentional parenting, nobody is born wise. Yes, they learn from us. Another one from the Hema people of DRC Congo. Wisdom is like fire. People take it from others. This reminds me of the village life, which I like. When you're making a fire, you don't have to start from scratch. You can go to your neighbor's house. They'll give you a burning log or one that is almost burning out. But when you come back to your house, you're able to use it to light a fire. And for me as a parent, I know that I'm passing legacies to the next generations, whether it's through my own children or through the parents that we reach out to directly. So those are brain connections happening, and we have said that the early years form very sensitive periods for brain development. And early years are foundational, yes, but when a child is very young, simply responding quickly and appropriately to the cues of children, their cries, because they communicate often through crying, is critical. And you're actually building their brains to trust. And we know that once your child, the little one, learns to trust, it forms a foundation for future relationships. And then on nutrition, as has been mentioned under the nurturing care framework, it's very critical. And during the first 2 years, WHO, UNICEF and others have emphasized about prevention of stunting, and also immunization and preventing under 5 mortality in the very early years. especially the first 1,000 days. We know that 0 to 2 years, everything that the child eats goes into 80%. 80% of all nutrition goes into brain development. So it's very important that they are feeding well. They are breastfeeding exclusively for the first 6 months. That actually really helps with brain development and stimulating the child. And then up to 2 years, at least 2 years of life, it's important to, yes, breastfeed, but give complementary feeding from 6 months, after 6 months. Other early implications of diarrhea, vomiting, and sickness in the early years. I think the rule of the thumb is to, at the first sign of illness, if you're able to go to the nearest hospital, it's important if you're not sure what's going on. Because diarrhea, vomiting, pure nutrition regresses brain development significantly. And a child who's not receiving intervention can die up to a day or two if not adequately managed. We may think that the child will just lose weight, but there's an impact on their brain development when you have diarrhea and vomiting. However, we also know that some children are resilient, and with intervention, they are able to emerge from adversity. But trauma, adversity, sexual abuse can result in toxic stress, and it also now rewires the brain architecture that we may have built earlier. Another African proverb from the Swahili is that he who fears the crying child will cry himself. And when we are training children, there'll be some tears, but with love, we are training this child, and it's going to help them in future. And to that, I'd like to go to a study that was done a while back, reflected in a book by some Kenyans, Anzaya and Bithea Katsa. So in 1964, Walter Mischel and other researchers at Stanford conducted an interesting study, and we'll see a short video later today. 4-year-olds were put in a room alone with a single marshmallow, and marshmallow can be substituted for any nice tamu-tamu that children would like, a sweet or anything, a chocolate, something that's available locally. So the marshmallow was given to them on a plate, and the researcher told each child that if he or she could eat the marshmallow right away, but if they waited until the researcher came back from an errand, they would get another marshmallow. Some children were able to wait 15 to 20 minutes. It took the researcher to come back. They distracted themselves by singing songs and doing all sorts of things, but some were more impulsive, and they grabbed it even before the researcher left. Of course, a follow-up study was done when these children were 18, longitudinal studies, which I very much like. And there were dramatic results when these children were 18. The children who waited for the second marshmallow were more resilient and would likely be more competent adults. That proves that self-control can be instilled early, and we know that it will last throughout their lifetime if done well. And then we learned from the study that children who could not wait were more likely stubborn, indecisive as adults, easily upset, regressing under pressure, stress, were jealous, resentful, and had poorer grades. And it looks like they are struggling as adults. Of course, there's a disclaimer. We know that recent follow-up studies, 2010, 2013, of this marshmallow test, it could be a chocolate, it could be a sweet, indicated that factors like affluence and poverty will impact on one's ability to delay gratification. And this, of course, stresses our context in Africa and our communities. We know that there's poverty among a majority. How can responsive caregivers nurture the young to reach their full potential? From my training and from what I've seen over the last 17, 18 years working in the field, is that a holistic approach of stimulating children ensures that firstly, we are passing down spiritual foundations, whether we are Muslims, we are Christians, and we must pass it very early. Even from pregnancy stage, we can read to these children whatever spiritual books we have, for example. But also that we study our family trees, because of the issue of naming and also tendencies amongst maybe our forefathers. And of course, we also learn from custodians of positive African traditions about the way we have done things as certain people in different communities in Africa. And of course, nurturing care has been extensively mentioned. But for me, I think the most significant thing is a responsive caregiver is able to provide all these inputs that are very critical, as we have been told by Dr. Teshome. But in Africa, we know that it takes a village to raise a child, and we need partnerships. So the Tanzania people tell us that 2 ants do not fail to pull 1 grasshopper. This parenting journey is not easy, especially when we're not able to have extended family support, with becoming very busy working parents, and probably even adding on to that, we have to study. We have to have partnerships that are helping us support the development of our children from an early age. I'm part of the AU ECED cluster, and the Quality Services Working Group is organizing an in-depth parenting workshop. So we may not go in-depth into more on parenting right now, but we will be hosting a fatherhood workshop soon, as early as from May. Please post pertinent questions, comments through info@afecn.org to help the teams organize relevant speakers. Then the other working group, the knowledge generation members, have shared a call for stories. We have extended it a bit. We are still accepting submissions for implementing childcare practices in the region. So I'm gonna share the link shortly, and please reach out to us so that we can disseminate your stories. The Renova Nation begins in the homes of people. I think my presentation today has said that, and this is an African proverb, showing that parenting is the bedrock of any nation. And there ends my presentation. And before we conclude, I'm going to invite Jennifer, who will ask about a question or so to interact with you in the marshmallow test video. Thank you very much. Over to you, Jennifer.
Thank you so much, Stella. As I said, I'm listening. This is my 3rd time to listen to this, and every time there is something new you learn. So this week, for the next 20 minutes or less, we are going to have an interactive session. So we have heard from 3 very strong presentations, but it's a training. It's not a webinar. So we need to hear from you. We want to get feedback from you on what you have understood. So I'm going to send to post a Mentimeter link on the chat. And what I want you guys to do is to be able to respond. As you watch this video, I want you to respond to the questions on the Mentimeter. So let me just share the video.
Good. Okay, so here's the deal. There's a marshmallow. You can either wait, and I'll bring you back another one, so you can have 2, or you can eat it now. So you can eat it now, or you can wait, and I'll bring you back 2. Okay? Okay. Okay, I'll be back. Okay, so I have 1 marshmallow for each of you. Okay. 1. Don't eat it. And here's the deal. You can either eat it now, or you can wait till I get back, and you can have 2. Okay? Okay. So eat it now or wait till I get back and you can have 2. And I'll be back in a little. If we wait, you'll give us 2? Yep, if you wait, you'll get 2. Or you can eat it now, whichever you want. Okay? I'll be back in a little bit. We're gonna wait.
So which child are you?
Well, we're still not going to get to. But if you wait until she gets back, she'll give you 2. She still won't give you 2 because you ate it some of it. And I didn't eat a single bite of mine. So don't show her, okay?
There you go. Okay, so I have this marshmallow, and you can eat it now, or if you wait a little bit, I'll bring back 2 for you to eat, okay? How you doing, Sam? Good, you've been eating. Okay, well, I'm gonna go and, I haven't found marshmallows yet, so I'm gonna look for some more, but you stay here, and if you haven't eaten that one, I'll bring you back another one, okay? I'll be right back.
Waiting. Well, you're eating, not waiting for her to get back. I still ate some of it, so she's still not gonna give it to her. Let's stay in your chair.
Here it comes.
There,
Oh, what happened?
she ate her.
Oh, okay. Hunter, you waited. You get 2. Good job. You can eat it. You can eat them now.
So I want to see in the Mentimeter. The Mentimeter link is in the chat. I've shared with everyone. So I just want to see one, if you had a child, okay, how would they respond? Okay, and maybe you just want to see, it was me. So replace the marshmallow with nyama choma or pilau. You know the pilau from you're from Kenya. Pilau from the coast, the real one, not the Njeri one from Nairobi, you know, the real pilau, or a huge burger, juicy with chips, or a glass of juice if you're a healthy person, a glass of really fresh juice, and you're told there's a juice or there's a nyama choma, for 1 hour, you look at it, no eating, you get $1,000. What will you be? Will you be that little girl, say, whatever, man, let me eat, it will never come? Or will you wait like the little boy? So I want to see your responses on, if you cannot be able to access the Mentimeter, you can have your answers in the Q&A section. And the panelists are there to respond. If you have questions about that experiment, also ask. Maybe you're asking yourself, that is not practical. So can you please just put them in the Q&A section as I pull up the Mentimeter just to see what you guys are responding. Yeah, thank you guys for responding. So I can see you guys responding. You wait, others they will eat. Others will play with it. Let me see. We'll wait. Just for a second. That's a good one. You're being honest. We just look at it for a second and let me just, hunger is real. Thank you guys for responding. So as you continue responding, I'm going to call Stella back to explain the marshmallow experiment further. Stella.
Jennifer, I already explained it. I think we have, but I can repeat a bit. I think, yes, we said that most of the children who waited are more likely to be competent adults when they become older. And that's because delaying gratification has been inbuilt in them, either through the environment or through their personality. But delaying gratification is mostly an environmental issue, because studies with twins have been done, and both fraternal and identical, and it shows that delayed gratification is a product of the environment and training. And then the ones who didn't delay tend to have poorer grades, as we had said. And yeah, so it's good for us to train our children early, but there's also hope in case they are not. I mean, we have adults who have tendencies, and maybe their delaying gratification was not done much earlier, very well. It's possible through therapy, counseling, and it doesn't mean that there's no hope. You can work with an adult or even a teenager, but it takes a while longer and different techniques to build delayed gratification. So this reiterates the importance of parenting early and training and looking at your child's personality and helping where they have weaknesses. It can be done through parenting, but we need to make time for parenting and to have important partners in the parenting journey. Thank you.
Thank you. Thank you so much, Stella. I hand over the meeting to Ben. Are you there?
Yes, Jenny, thank you so much. I really want to appreciate all those who have made presentations, starting with Maniza all the way to Stella and Daktari. So according to our program, we are supposed to be going for a health break. However, experience with online meetings has shown that we lose more participants when we break sometimes. So I don't know whether because of time, we will move to the next presenter, then we will go for Q&A before we break. Kindly advise Jennifer.
I think we can do Q&A right now. So those ones who need to take a break, they can take a break and come back. So we can take a Q&A right now. If you have any questions, please lift up your hand. You'll be allowed to speak. If you are shy to speak, we have the Q&A section where you can be able to type in your question. I can see your hand, Rockefeller. So if you have any questions, you can lift up your hand and then we'll try to respond. And at this time, if you feel like you need to step out, you can step out and take a cup of tea and come back. So at this moment, we just have a Q&A. So I'm going to, please lift up your hand so that I can allow you to speak, because you cannot be able, I need to allow you to speak from my side.
And I think as we pick those questions from participants who will be raising their hands, we also have some questions in the Q&A which were asked earlier for the presenters, that is for Maniza and Daktari. And I think there are those questions that might be of benefit to the rest of participants. So we can have those questions also responded to, not for the sake of just the one who raised them in the Q&A, but also for the sake of the rest of. Yeah, I can see Rockefeller, okay?
Yes,
you had
I'm
a question in the
Rockefeller,
Q&A. Yes.
Yes,
Go
yes.
on, please, Rockefeller.
Yeah, I'm from Kenya, Homa Bay, and I'm a person with disability. I got it rough during my early childhood, you know, the self-esteem issues and all that. So my question is, during early childhood development, referring to children with disability, how can we make sure that these children grow up confident and without inferiority complex in them? Because they are a disadvantage at the word go. And again, I would like to correct something little there, but just on the passing that we are not living with disability. We are people with disability. I live with my children and wife in my house, and you won't get anything disability. You can't point at the disability. It is not a pet. Disability is not a pet. So we are people with the disability. Having said that, we find that in normal circumstances, more so in the households where the environment is favorable and all that, some children still end up growing, not knowing east or west. They grow up confused. They grow up not successful in life. What explains this? Otherwise, thank you.
Thank you so much, Bwana Okeo. I don't know whether it will be prudent for Daktari or Maniza to respond to the question as we get another question. Thank you. Daktari Teshome, kindly go ahead and respond to Rockefeller. Okay.
Yeah, thank you, Chair. Thank you very much for that very important question. Children with disabilities have been forgotten in the system, and this is getting a lot of attention because now we have the numbers, and the WHO and UNICEF are coming up with with guidance to address this group of population because they have special needs. They need special services. To start with, they are not even identified. So a lot of attention is being given, first of all, to identify children with the disabilities, and secondly, to establish services, referral services for children with disabilities. Unfortunately, in most of African countries, we don't have that specialized services to provide that kind of targeted services, but this is part of the plan. In terms of even pre-primary education and the rest of education, they have special needs. This has to be considered, and appropriate placement is extremely important for them so that they will be assisted and their needs are met in order for them to catch up and be able to become capable in acquiring the essential knowledge and skills that will be equipping them to be productive and self-sufficient. And their needs require a multi-sectoral response. And this is an important point, but this is really one of the priority that we are paying attention. I think this is what I can say in brief. Thank you very much for bringing it up, and this is extremely important. Thank you. Over to you.
Thank you so much, Dr. And actually, the issue of children with disability is something that most governments should be very, very keen on, because when you look at even our infrastructure, when it comes to physical disability at our schools, starting at an early age, you find that even our ECD centers, most of government ECD centers do not take into consideration aspects of children with disability. And it starts at that infrastructural level, design of classes, design of schools, and even the toilets where children go for their biological call. So these are some of the advocacy issues that also as CSO child rights actors, we have to pick them up. And some of our contractors who are given contracts to construct schools, to construct infrastructure in schools, have also to be trained on some of these issues when it comes to children with disability, especially with the physical disability. And it is even more complex when it comes to other disabilities. So, Dr. this is an area that will need your support, and even coming up with modules that can assist actors and governments to put these in place. Thank you very much. Any other question from participants, please? Joseph Gitu, I can see your hand is up. Kindly.
Thank you. This is Joseph. I'm talking from Kenya, Nairobi city. My question is on children living on the streets. I know we have about 15,000 children living in Nairobi city who are on the streets. These children have been chased away one day. Sometimes they're being fed by well-wishers, the CSO. This is not sustainable. And looking at the presentations that you've just gone through, which are very insightful, I was wondering what could be done by governments or the states to ensure that children are brought out of the streets and their needs are addressed from the very young age, I would say 0 to about 10 years. What is the best practice? What could the CSOs or the NGOs or the governments, how can they come together and address this need? I know even as we formulate strategic plans or the budgets for the countries, most of these children are left out. They're not treated as human beings. And as people who advocate for the rights of children, I think it's high time for us to urgently have some considerations on how these children maybe can be reintegrated, because no child came from above. They all came from a certain family. It's high time for us to have some parenting skills for the caregivers. It's high time for us to have some kind of subsidies from either the CSOs or the governments to ensure that these children enjoy their rights by being supported by either the caregiver or a system that is sustainable, because children homes are no longer the best place for children, but rather they should grow up on their culture. They should have the rights being adhered to according to the four main rights: the survival, the development, the protection, and survival. Thank you. Over.
Okay, thank you. I think we'll have someone from AfECN or CSO Forum to respond to that. And as they prepare, allow me also to bring in a question from Kennedy Ouma. I can see your hand up so that this can be handled, two questions can be handled together. Kennedy.
Thank you. My name is Pastor Ken Ouma. I'm the Secretary for GenLink. I come from Homa Bay County, Kenya. My concern has been about the adopted children. You will find that most of the time you have adopted an orphan and you give them equal treatment. And they usually feel dissatisfied and somehow behave differently. What happens? Because if you come to their understanding, maybe you have got little resources to provide for meals, and they feel that they are just being neglected. They feel that they are not being served rightly as compared to your normal children whom you live with. And I've realized that the most difficult child to live with is an orphan. They tend to behave queerly. What happens?
Yes, thank you very much, Pastor Ken Ouma, for your question and your concern. And I think I'll bring in our experts to respond to
There's one more question.
questions.
There's one more question from Thomas Bwire. So, and then I think...
Okay, yes, Thomas, go ahead. I didn't see your hand. I just saw your video.
Okay, I'm here. Thank you so much. For me, I also just want to have a better understanding, especially during this time of COVID. We have seen like key messaging targeting COVID messaging, like on the general public, and also like just the other children who don't have any disability. So maybe perhaps maybe as CSOs, as experts in this field, like, has there been any initiative to also target children living with disabilities, just when it comes to messaging on COVID-related messages, so that they're also able to have a better understanding? For example, like, how does a child able to understand like they need to wear a mask, or even just they need to wash hands regularly? How have you guys tried to also reach out to them with just key messaging, like maybe with a sign language, or just a way that they can also be able to communicate in the society? Thank you.
Thank you so much, Tom. Your question and concern about messaging on COVID-19 related messaging to children with disabilities. I'll bring now in the experts all the way from our panelists, Daktari and Maniza and Stella, and also someone from the CSO Forum to respond to these questions without any order. The question that was raised by Joseph about the challenges they face, especially in line with our training today on ECD and parenting. Then Kenneth Ouma raised a concern about adopted and orphaned children. How can they be also supported? And also his concern is about why is it so that sometimes it is a bit challenging, or that children who are orphaned are a bit difficult to bring up, and if it is something that experts will also respond to. Then Thomas is concerned about COVID-19 messaging, and I think this one Jenny will be able to handle effectively. Thank you very much and welcome. Can we start with Jenny, please?
Sorry. Maniza, are you able to take some few questions? Is Maniza with us?
She could be in another meeting, but Dr. Teshome had put up his hand and he can.
Okay, Dr. Teshome, okay. Dr. Teshome?
Yeah.
Yeah, thank you very much. I may not address them in the order, but the issue of street children is really an important problem, and that we are seeing it in many countries. Definitely, this should be the priority of member states, but at the same time, we know countries have limited, especially, government has limited capacity. Although we appreciate the issue of prioritization, but even if they want to support and reintegrate these children back to their families, some have lost their social network. A lot has happened and a lot of damage has happened in the children. So I see a lot of complexities, but the civil society has a lot to do really to advocate for this, so that government should be able to do its part. But the private sector has a lot of potential, which we have not tapped. We have very rich people in every country with a lot of wealth that goes into generations. So if they are properly really briefed and approached, I don't think they will hesitate to help these needy children. So engagement of the private sector for this noble cause will be a strategic approach, but with the leadership of the government. If reintegration is possible, that would be the preferred way, but it has also a lot of management issues. But even taking them to an institution with proper parenting services and support will definitely help them develop their developmental potential than where they are now. So I think we need to look at really the potential of the private sector to come into this important issue. They have a lot of potential. The issue of orphans, neglect, this boils down to really a lack of proper parenting, responsive caregiving, because we put these children in institutions. They would be fed at a particular time of the day. They don't enjoy responsive caregiving. They don't enjoy play and communication. So the parenting element is missing. So a lot can be improved with proper parenting, training of the caregivers, and keeping also the same caregiver to a group of children. If you remember your experience, if you have a maid in the house and your wife is going to work and the child prefers the maid than the mother, because the child refers the care she's receiving on continuous basis. Huh? So we can actually improve a lot by improving parenting and responsive caregiving and play and communication using the available resources. We can do better with what we have. The COVID messaging, I think that definitely that can be addressed, tailored to children with disabilities, because they have special issues, special needs, so the messaging should be tailored to their context and situation. Thank you very much. Thank you. Over from my side.
Thank you, Dr. Tshome. Stella, are you able to take a few questions? Stella, are you there? If not, I think we're going to move on to the next presenter, Caroline from Save the Children, who is going to give us the relationship with between ECD and child protection. Caroline.
Thank you so much. Thank you, everybody. I feel like because I did this yesterday, I feel like I know you already, but I know it's a new group. So, you know, good morning. My name is Caroline Gusabe. I'm a senior early childhood development specialist with Save the Children. I'm based in Kigali, and today I'm very glad to join you to discuss the links between child protection and ECD programming, and also in general looking at how child protection looks like in the early years, discussing what is going well currently in the region in terms of child protection in the early years, and also looking at areas where we can improve in order to increase the safety, protection, and well-being of our youngest children. So before going into what is going well and what is not going well, I wanted us to reflect on the impact of stress on young children's development. My colleagues have already shared a lot of this, so I'm just building on that background. From what I think it is Moniza who shared about the impact of stress on children's brain development. And I just wanted to bring back that picture. So I think she shared with you this picture of a healthy brain in comparison to a brain that has been impacted by environmental stress. And you can see that the brain which has been affected by environmental stress has some regions of the brain poorly developed and some totally missing. Dr. Tshome, I think, is the one who talked about pruning. Stella also talked about pruning. So when there is no interaction, no responsive caregiving, the brain interprets that those connections are not needed. So they are pruned off and they disappear. And then if there is a lot of stress on the child, it increases the amount of toxic stress in the child's brain, and that adds more damage to the brain by destroying some of the connections. And this is what happens to that brain. You can see in comparison to the healthy brain, there are big chunks of the brain that are missing. So that is why we need to think very critically how we can protect our young children and also reduce the stress in the environment in which they live. And the babies begin to experience and be impacted by stress even while they are in the womb. For example, if a mother is pregnant and they experience stress from domestic violence or from, pressure because of poverty or some other reasons that cause the pregnant mother to be extremely stressed, it raises maternal cortisol levels. And the cortisol is one of the hormones that are released in our bodies whenever we are very stressed. It is a natural occurrence, but it is not supposed to stay activated in the human body. When it stays activated for long, then it becomes toxic and begins to cause damage. And when the mother is pregnant, those toxic hormones can be transmitted to the child, and that can increase the chances for preterm delivery, low birth weight, and other complications at birth. And once the child is here, we know that those children who grow up in extreme deprivation, for example, or interaction with the loving adults, ongoing persistent stress, let's say from the parental emotional instability, domestic or community violence, neglect or food insecurity, fail to build healthy brain connections because of this ongoing toxic stress as well. And we also know that the children who are growing up in this type of world perceive the world to be a threatening place, and they develop a wide range of conditions that trigger anxious behaviors, and this impairs their ability to learn and also interact socially. So maybe that is one of the explanations for this question on the child who is an orphan. Maybe they perceive the world to be a threatening place. It is not safe. They are not loved, and then they begin to have these anxious behaviors, or they begin to display negative coping mechanisms. So we are going to discuss a bit more what can we do to improve that situation. But the first thing is to recognize that even the youngest children can experience stress, and that stress can manifest in different ways, including these anxious behaviors, but also internally, it is damaging the brain infrastructure.
Excuse me, Carol, please share your screen.
Oh, sorry, I forgot to click on that button. Silly me. Sorry about that. This is what happens when you're excited about the topic that you're sharing about. you forget to do some things.
Absolutely.
Yeah. Can you see my screen now?
Yes, we can. Thank you.
Okay, great. So this slide here is what I was using to discuss the impact of stress on a child's brain and also the development. So right here is the picture of the healthy brain, and then the picture of the brain that has been impacted by stress. And you can see even in the MRI that you can see the big difference between these two brains. But then also remember the behaviors that result from exposure to this amount of stress. So I also wanted us to discuss about the issue called the childhood adversity. In some circles, they call it the adversity childhood, adverse childhood experiences index. And this is an index that calculates the impact of multiple adverse factors on a child's development. And what these studies about the adverse childhood experiences have found is that one factor alone may not radically affect the child if they have positive factors. Let's say the child is born in a poor household, but they have loving parents who do responsive caregiving, they have a supportive community, and they access basic health care from the government. So in that case, the adverse factor of poverty is kind of balanced by the positive factors from the family and the healthcare system. So that one adverse factor, the impact of that one adverse factor would be limited. But let's say if there are two, the child is poor and they are also experiencing maltreatment. Now it starts increasing the chances of the child having serious developmental delays, or increasing the chance of the child ending up with, in the future, ending up in the juvenile justice system, having poor development, because now the factors are becoming more than one. And whenever we have more negative factors, we assume that on the other side, it's like a scale. The other side is now becoming less powerful. So the more factors the child is exposed to, let's say 7 factors, the higher the chances of these adverse factors in combination acting to limit the child's development, and also increasing the chance of this child having poor schooling outcomes, higher chances of ending up in prison or in criminal behaviors in the future. So the more adverse factors, the worse off the situation for children. And in fact, in some countries like the US, they use this early childhood adverse childhood experiences index to predict how many people they will have in their prisons in like the next 20 years. But hopefully they also use it to do some corrective measures. So this is to say that when we are thinking about protection in the early years, we should think about all these factors and reducing them as well as increasing the protective factors like the responsive caregiving, access to health facilities, and other services, which I'm going to talk about. But briefly, if I can share on some of the adverse factors maybe that I didn't mention. So we have poverty, we have child maltreatment, we have domestic violence, we have caregiver substance abuse, we have caregiver mental health problems, and also low maternal education. So this one is interesting. In some other sessions, people are asking why this matters, because the low maternal education is linked with low knowledge, for example, on healthcare, low knowledge on how to support early learnings, and that ends up impacting the child. So we are not saying that fathers are not important or fathers' education is not important, but in the current literature, maternal education is one of those factors. So we should try to increase both the father's engagement, the mother's engagement, as well as support programs that increase the knowledge of mothers, including through parenting education. So it's not just formal education. So how does the child protection in ECD look like currently in Africa? As somebody pointed out in the chat earlier, we have wonderful policies. And those policies, integrated early childhood policies in the region, emphasize child protection as a key area of program implementation and service delivery. We can give examples of the Uganda's National Integrated ECD Policy, Rwanda's 2016 Revised ECD Policy, Ethiopia's EC Policy Framework of 2010. They all have a strong focus on child protection, but implementation remains a challenge. I heard there are some colleagues from Kenya. I imagine the situation is similar. You have a wonderful policy, very good strategy documents, but the implementation is a bit challenging. So before we talk about the challenges, let's talk about what's going well. So first of all, we know at the policy level, we have the right policies, very well done, and the child protection is emphasized as part of the high quality ECED programs. And also governments in this region emphasize birth registration, which supports sector planning for services targeting young children. And Dr. Teshomi has shared that we even now are beginning to have data on children with disabilities, which is very important. Some countries also have parenting education frameworks or curricula that emphasize child protection. And there are some promising parenting programs like Parenting Without Violence being implemented, especially by NGO actors, but not at scale. And I will share a little bit about why also there are some gaps in these programs, especially around the age appropriateness of messages. At the school level, there is attention to child protection, for example, institutionalizing the teacher code of conduct, training of pre-primary and early grade teachers on and ECD caregivers on child protection at both in-service and pre-service level. And then most countries in Africa have banned corporal punishment, and the ban expands to the early years. In addition, countries like Rwanda are carrying out social behavior change messaging on general protection. I'm saying general protection because the messages are not specifically for targeting families and communities where the young children are living, but it's child protection in general. And this is being done via push notifications, public sector announcements on TV and radio, etc. But what are the areas in which we can improve? Child protection messages and strategies need to be age appropriate. If you look at the current curricula, we have strategies, suggested activities, most of them apply to the older ages. So for example, in positive discipline, they will say, give the child a timeout, but you cannot give a baby of 6 months a timeout, right? As part of disciplining. because it's not appropriate for that age. And also when it comes to discussions around abuse, you will hear a lot of mention about child marriage, FGM, hitting and beating, but there is not enough being said about how abuse and violence looks like for the younger ages. So there's not enough talking about things like shaking the baby, holding the baby upside down, ignoring the baby when they cry for help, neglecting to give early stimulation to the baby because we saw it can cause damage to the brain. There is not enough talking about, for example, accidents, protecting young children from accidents. So basically, we should recognize that child abuse and violence looks different for the different ages. So we should provide age-appropriate messages and support to parents, because every parent wants to have their child growing up to be healthy and safe, but how to do it, they don't know. So we have to be very specific about the age and which strategies. In addition, we need to emphasize social behavior change communications, because if I'm quoting from the Ethiopia ECE policy framework, adults still consider certain forms of physical and psychological punishment as generally acceptable ways of disciplining, as long as they are not excessive. But what is excessive? Especially when we say excessive for a baby, what is that? What does that look like? Or a young child, or even an older child? And then we know that beating is one of the most common form of punishment for the older children. But for the younger children, we also know things like pinching, when the baby is breastfeeding, and because they are beginning to teeth, the teeth are growing and the gums are itching, they bite the mom and the mom pinches back, or the dad pinches back. So those type of punishments are common, but also there are other forms of abuse affecting young children, and yet they seem to be acceptable in the culture. In yesterday's session, someone told us that in their culture, I think in Southern Africa, shaking the baby and holding them upside down is considered a good thing because it will help the baby overcome the fear of heights. But we know that this action causes trauma to the brain that is equivalent to the child being in an accident. Yet in that culture, they think it's a good thing. So we need to invest in culturally appropriate SBC, so that we don't collide with the African culture, we don't collide with our existing values, but we find a way, like Stella was doing, to use existing proverbs, existing sayings to be able to communicate child protection messages appropriately and be able to transform some of those negative behaviors. Another thing is that child protection in ECD needs to go beyond positive discipline, because like I said, disciplining is not the only issue. So we need to encompass responsive caregiving. Dr. Teshome mentioned that responsive caregiving is the platform on which everything else happens. We also need to emphasize caregiver well-being, because a lot of the abuse of young children happens because the adults are not able to control themselves. They are stressed, they are worried, and because of this, mental well-being issues they have, they are unable to provide the responsive caregiving. They are very harsh when they discipline their children. They neglect their children's needs. So we as part of the child protection for the younger ages, we need to consider seriously the caregiver well-being. And also we need to think of child protection broadly, physical, mental, and also psychological safety of the child, and looking at all parts of the environment, home, community, and school. There is also need for us to invest in understanding online safety, especially for young children, as we are increasingly interacting in the digital world. So access to digital services is becoming, it's growing at a very rapid pace. I heard that in Kenya, it's now at 100% access to smartphone technologies, but that beyond 100% actually, because some people own more than one smartphone. And these smartphones, gadgets, computers, they end up in the hands of young children. We know that parents are beginning to use the phone and other gadgets as babysitters when they don't want to deal with the child's request for attention. And some of these gadgets have inappropriate content, but also children are spending unhealthy amounts of time on the screen. And this will have repercussions on their development, especially on their brain development. So we need to start thinking seriously, how can we address safety online? And also we need to continue bridging the gap between child protection workers and ECD workers by increasing the ECD knowledge of child protection workers, and also strengthening the referral pathways and mechanisms between ECCD centers, parenting groups, and community child protection systems, because this is where the cases will come from. And we need to build evidence around child protection in the early years. For example, doing more studies on violence against, how violence against children looks like for the younger ages. I think the only study now we have is the one from UNICEF that was looking at violence against children in the younger cohort. But we need more studies in order for us to have a good basis for intelligent programming and also advocacy. As I sum up, I wanted to share some thoughts around what type of programs can be leveraged to increase the safety, protection, and well-being of young children. I'm glad somebody already mentioned the social protection. So we need to ensure that vulnerable families with young children have access to cash transfer programs, other social protection programs, and even have financial literacy, because we saw that poverty is one of the adverse factors that have impact on a child's development, but also it can increase stress on the household, and that stress somehow can come out as abuse against children because of the inability of the parents and other caregivers to deal with the stress resulting from poverty. We also need to work on the mental health and psychosocial support. As I said, is a very important part of protecting young children. So having psychosocial first aid training for all frontline workers, including the child protection workers, strengthening the referral pathways, and also having child protection messages in the antenatal care and postnatal care platforms. Because when the parent is getting ready to give birth, they receive some messages on health, they receive some messages on nutrition. When they go for postnatal care, they receive additional messages. So they should also receive messages on protection. In developed countries like the US, they do have a session on the shaking and hitting that I mentioned, because it's a common cause of trauma against brain trauma in young children over there. And the parents are made to watch a video during the postnatal care sessions, and they're made to watch a video that is emphasizing messages around safety and protection of young children, including safety from accidents. So this should also be included in our programming, in our health programming. And then we need to strengthen, activities to reduce family violence and also responding to cases of violence, because when a child is in an environment of violence, whether the violence is directed at them or directed at other members of the family, it still affects them equally. So we should be strengthening GBV activities, linking families to hotlines, and especially intellectual disabilities limit the child's ability to communicate appropriately. They limit the child's ability to tell the dangerous person from the friendly person. They are not able to tell who they should trust and who they shouldn't trust, because their disability has affected the parts of the brain that relate with the social-emotional learning. So because of that, it's very easy for abusers to take advantage of them. So we've had, for example, in Kenya, rising cases of children with autism being sexually abused. And what makes it worse is that because these children have challenges with communication skills, they are not even able to explain what happened to them. So it's very important for us to think very specifically and intentionally about how protection looks like for children with different disabilities, and what we can do to ensure that they have protection and they are able to enjoy the rights to accessing education, rights to interact in community, rights to even be parented appropriately, because some parents neglect the children with disability. They refuse to take them to school. So we need to intentionally invest in working around the intersectionality between the disability and child protection. And lastly, when it comes to early education, we need to ensure that teacher training includes safe school programming, and the teachers and other caregivers have messages and even strategies on how to protect young children and increase both the physical and psychological safety of children while they are in the school setting. And also these schools and other institutions should set up referral mechanisms so that they are linked with existing child protection mechanisms in case cases come up. And lastly, I think that we should continue advocating for child protection focus in ECD. I called it child protection sensitive ECD, not because the current ECD programs don't have a child protection focus, but it is weak. So we should, increase that component, and that will require some advocacy. And also we should increase the participation of ECD experts in child protection forums. So that's why I thank the CSO Forum and AfECN for inviting us to have this opportunity to discuss with you colleagues who are working in the child protection space, so that we can complement what you're doing with our ECD knowledge, and together we can ensure the safety, protection, and well-being of our youngest members of society. Thank you so much. Over to you, Stella.
Back to you, CSO Forum, for the next steps. Thank you, Tusabe.
Thank you too.
Thank you, Caroline, and thank you, Stella, for the insightful presentation. We say Amahoro Nimeza.
Nimeza
I don't know whether I'm still recording my.
Yeah, your Nyarada is good.
Yeah, thank you so much.
Thank you.
Okay. At this juncture, I'll take to our next presenter now that we are running out of time. Our next presenter is Patricia Martin, and that is the role of CSO in advocating for the youngest children. Thank you and welcome.
Sustainable Development Imperative. What I would like to start with is just outlining the legal foundations upon which one would base an advocacy argument or an advocacy demand for systematizing ECD to operationalize nurturing care across a country or across a region. So we all know sorry, that just muted me for some reason. We all know that ECD is a rights-based sustainable development imperative. And what this means is that every child has the right not just to survive, but to develop to their full potential. This right is protected and it's key to sustainable inclusive development. And the reason being is that realizing rights across the life course is important, absolutely crucial to development of individuals as well as socioeconomic development of countries. And critically, the realization of the rights of children in their early years are absolutely essential. And in this regard, there's a number of rights that are particularly important that are regarded as gateway rights. And these are the rights to health, nutrition, family care, protection, social security, and participation. So the right to these rights in the early years are recognized as particularly important by treaty and development instruments, as well as a number of national policies and laws. And what this means, the recognition of ECD as a rights-based sustainable development imperative, creates the implication of that is that it creates a responsibility on governments to systematize ECD as a publicly provided composite package which supports early development outcomes. So ECD is recognized as a rights-based sustainable development imperative, not only by your global and your regional instruments, but also national policies which have domesticated some of those responsibilities. Now, all the countries in Africa have ratified the Convention on the Rights of the Child and the African Charter on the Rights and Welfare of the Child. That act of ratification amounts to a commitment to implement the rights that are protected. So there's an automatic responsibility as a result of the ratification of these instruments. And that ratification creates a legally enforceable right, which can be used in courts quite comfortably, as well as complaints mechanisms established by these treaty bodies. In addition, there's the SDGs, there's Africa's Agenda 2063 and the Agenda for Children 2040, which do not have the same legal status as the conventions, but carry a lot of weight when it comes to influencing government planning and provisioning. And all of these are very unambiguous in the prioritization of early childhood development as a sustainable development priority. Similarly, we see this recognized at the sub-regional SADC, ECOWAS, and East African Community Development Plans recognize ECD as important. And then at the economic level, the G20 Initiative for Early Childhood Development is an example of the kind of economic blocks coming behind ECD. We also then have a number of global sectoral instruments which really endorse and require systematization of ECD. For example, the Survive, Thrive, and Transform agenda, which speaks especially to the health sector, as does the Global Strategy for Women, Children, and Adolescents Health, and ultimately the Nurturing Care Framework, which brings most of these together into a set of policy directives for systematizing ECD to build the human capital necessary for sustainable development on the continent. Now, what we have seen as well is that national policies across the continent have been adopted which domesticate these commitments and these responsibilities and obligate systematization of ECD. And we have in many countries seen the adoption of a national integrated ECD policies. Some haven't yet, they're getting there. But outside of that, we have a number of children's laws, child protection strategies, policies and laws, child health development laws, child education laws and policies, all of which recognize certain elements of early child development as key to promoting the development of children, and then ultimately as the foundational building blocks of sustainable inclusive development. Often what is missing at this national level is one integrated policy or law that brings all of these together to found a national integrated ECD system. And that's something that we will talk about because it's a really important component of an effective ECD system. So, pardon me, I'm sorry, I've been a little bit ill, so I'm a bit croaky. So why is ECD a rights-based sustainable development imperative? Why does it get pushed to the top of the list of national priorities? Well, the evidence is clear. Increasing investments in rights in the early years to secure nurturing care lays the foundations for the human capital that we need for sustainable inclusive development and for the realization of rights. Effectively, it lays the cognitive, social, health, and emotional foundations required for human development. And as we've seen from Heckman's initial curve, his original work, it shows that investments in ECD have significantly higher returns in terms of human development and human capital growth than investments in later programs for adolescents and youth. And most recently, Heckman has revised the data and the research and showed that ECD investments can in fact be doubled if countries put their money into a comprehensive package and not just early learning. So his initial work really, I think, focused on investing in early learning rather than later tertiary education, for example. However, as the science has evolved, we know that when we're talking about investments in ECD, we need investments in a package of support to secure the holistic development of children. And the data, the longitudinal studies that have been conducted show that if you invest in these comprehensive programs, your return, your rate of return on that investment doubles from 7 to 13%, which is pretty good odds. And provides a very solid basis for advocating for increased investments in ECD as a comprehensive intervention, which is really important given the sort of shrinking fiscal envelope that we face, which is ever increasingly under pressure given the latest kind of humanitarian crisis brought on by COVID-19. However, what is really, really important to note, and this is a very important proviso when it comes to advocacy, is that to realize those returns, to unlock the equalizing potential of ECD, requires that a universalized package of comprehensive ECD services that responds to localized risks to enable the provision of nurturing care is provided. That there must be a focus on the very earliest years, commonly referred to as the first 1,000 days or the first 2 to 3 years, on health, nutrition, responsive parenting, and early learning from birth, and not just on creches, which generally kind of come into operation from the age of about 3 or 4 years old. The focus has to shift or balance out, because it's not about neglecting the later years, but we need to place a strong emphasis on and strengthen the provisioning in that early first 1,000 days across this comprehensive range of services. And then critically, in order to equalize development, we need to make sure that there are special measures that guarantee support for especially vulnerable and the chronically marginalized children. We have to equalize the development opportunities of those children who have historically been excluded and who are at real risk of developmental delays, and that includes children with disabilities, the very youngest children, as we've just spoken about, children living in extreme poverty, children of teen parents, children of parents living in abusive relationships and exposed to substance abuse, and children in the care of kin whose parents have died or who have abandoned them. So what are the implications? What are the responsibilities on government, given that ECD is a rights-based development imperative, and given that the returns will only be realized if the investments are strategic to secure the outcomes we've spoken about. So because it's a rights-based development imperative, governments must establish integrated, robust ECD systems that are capable of securing the equalization and optimal development of every child to their full potential. That means that your systems must be strong enough to secure universal reach and sustain provision of quality ECD services from conception until formal schooling. They must focus on the first 1,000 days. The services must reach the hardest to reach, the most vulnerable. And they must be reached with a comprehensive, age-appropriate package of services that address the risks that their families face and enable nurturing care by the parents and caregivers. And it's got to happen at scale. By 2050, it is estimated that we will have 1 billion children in Africa. So we are talking about incredibly robust, sophisticated, and well-resourced systems that have to be in place. So the question then is, how do we do this? The Nurturing Care Framework and the various guidelines and handbooks that have been developed provide direction on what is required and how to accelerate ECD provisioning. And the answer is simple: to scale up integrated ECD through systems strengthening. So what the Nurturing Care Framework and the guidelines do is they take all of the evidence and the legal obligations that are in place, and they create a set of policy directives which are summarized as follows. Governments must enable nurturing care environments, and they must do this by securing the provision of services at community level to enable every family or caregiver to provide children with the nurturing care they need to develop to their full potential. This means they need to be enabled to provide the services and care children across the 5 domains of nurturing care. All children must access all 5 domains of care that are age and developmentally appropriate. It is not enough for some children to access only some of the following services. All children must access healthcare, nutrition for development, responsive caregiving, opportunities for learning from birth, and safety and protection. In the absence of one of these, your development outcomes and your returns are drastically reduced. We know that providing early learning for a child who has been ill and is stunted and experiences cognitive impairment, providing light touch, poor quality early learning is not going to make any significant difference to the development outcomes and the employment prospects of that child. So in very simple terms, all 5 domains must be realized for every child. And the way that this can only be done is through the development and adoption of a public ECD system that mandates and enables universal nurturing care for ECD. So what are we talking about when we talk about a public ECD system that can do this? What should the system look like to achieve this goal? Well, any system, as you know, is made up of different components. So we're talking about the delivery of a package of services across multiple sectors to many people requiring technical resources and infrastructure. And this requires the allocation of resources, the development of human resources. But in order, we all know that for government planning to get to that point, no organ of state or ministry or government department will act without a clear, explicit, and unambiguous policy mandate and a legislative framework in which to operate. So the very first requirement of an ECD, public ECD system that will secure the outcomes that we are looking for is to have policies and laws, both national, integrated, and sectoral laws, and policies that mandate and obligate your different role players to realize the ECD rights in question. Once we have that in place, then your different administrative structures can develop comprehensive integrated programs that provide the combinations of supportive services to address the risks that enable nurturing care. And this will be your second element of your system. You've got to have these programs in place that cover all 5 domains of nurturing care. You then need adequate financial, human, and infrastructure resourcing, policies, strategies, and provisioning to support implementation at scale, quality, sustainability, and the coordination and management of this package. And critically, you need an information management system to align to this, which will secure the collection of data, monitoring, analysis, and reporting that leads to evidence-based planning, provisioning, and continuing improvement in ECD rights provisioning and outcomes. And none of this will be possible, given that we're talking about a government-wide response that we are looking for. We're talking about government-wide mainstreaming and prioritization of ECD. None of this will be possible without effective national leadership and coordination that secures government-wide prioritization and integration of ECD across the governance continuum. So what then is the goal of the system? It's to secure government-wide recognition, mainstreaming, actioning, and accountability for enabling nurturing care for ECD. It is intended to universalize services. One of our challenges that we've had, especially in the context of ECD, is that it largely has been privately provided, especially in the context of early learning, and only a very few number of children receive even only some components of the ECD package. The focus or the goal of the system is to universalize this package, and then so doing secure optimal outcomes for children so as to secure sustainable development of countries and of the continent. So when we look at this framework and this sort of set of rights-based responsibilities to systematize ECD, let's look at how well Africa is doing. What are some of our major systemic gaps? I'm going to jump in on the gaps. I know it's not great. I know we should focus on the positives and what is in place. However, we limit it in terms of the time, and what we're really wanting to focus on is what do we need to strengthen? So we need to look at what the gaps are. Let's start with a big picture. We know that Africa is falling behind on the Sustainable Development Agenda, and that is largely because of a failure to realize ECD rights. So the World Bank has projected that sub-Saharan Africa is last in the 2030 race. Whilst poverty and inequality has been decreasing globally, it is increasing in sub-Saharan Africa, and it is estimated that by 2030, 9 out of 10 people living in extreme poverty will be in sub-Saharan Africa. We will not achieve the SDGs. And the reason for this is that we are not enabling at scale nurturing care and realizing developmentally critical rights in the early years. We've heard earlier presentations which talk to the statistics, and effectively 2 out of every 3 children is at risk of poor development outcomes. So when we talk about those 1 billion children by 2050, who should be a profound asset and secure sustainable development, structures like the African Child Policy Forum have said in the context of the weak systems that we face, that's actually more like a ticking time bomb. And unless we do change how we do our business, we really are set for a very bleak future. So let's look at the nurturing care domains and identify where some of the biggest challenges are. So in the context of health, we know that maternal mortality rates remain high. We are seeing incredibly high levels of adolescent pregnancies and births. There are still far too many avoidable infant and child deaths. And we are seeing untreated maternal mental health problems, which create enormous challenges for responsive caregiving and protection of children later on down the line. So it doesn't just impact on the health outcomes, but the holistic development outcomes of the child. And critically, what we are seeing, and this is really one of the fundamental problems, is that in the past, or over the past 2 decades, we have seen massive investments in strengthening primary healthcare systems. But the focus has been on reducing child and infant mortality. And we've seen very impressive gains in this regard. Infant and child mortality rates have dropped enormously. But in a context of increasing poverty and inequality, What we are doing is we are increasing the pool and the number of children who are at risk of development delays and disabilities. And that's where the nub of the problem lies. We need to equalize the strength of the development support services in health and the other sectors to make sure that we catch these children that are surviving and ensure that they now develop to their full potential. When it comes to nutrition, there are many problems. I mean, nutrition remains a huge problem, malnutrition, but I think our biggest challenge that we are seeing, because this is so fundamentally linked to cognitive development, is that our stunting rates remain and are very high and continue to increase. When it comes to responsive caregiving, we see a very limited capacity to provide positive responsive caregiving. The challenge with responsive caregiving is that we have very poor indicators to give us some indication of the scale of the problem. However, if we use the proxy indicator of the rate of the use of violent discipline against young children, we know that that rate is incredibly high. And as the previous speaker said, it's not just the use of corporal punishment, it's the use of emotional and social abuse as a form of discipline, which has long-term consequences and is the antithesis of responsive caregiving. So responsive caregiving is a really problematic space, and the lack of good indicators is a very clear indication that this systemic component is very weak. Where you have good indicators, generally it points to a stronger system. When it comes to opportunities for learning, we have stronger systems in place and we have improved access. However, what we see are great inequities here. Access to affordable early childhood education from birth is limited. Children under the age of 3 are not accessing quality early learning and stimulation in the home. Access increases after the age of 3 when you enter into structured programs, but for those who do access, quality is very poor. For those who need high quality early childhood education, the most disadvantaged. And what we are seeing is this is where we start seeing the patterns which then repeat and grow exponentially across this full sort of life cycle in school of children. You see poor early learning outcomes amongst vulnerable young children, and this then results in poor and unequal school readiness and performance, which sets the patterns for intergenerational transmission of poverty and inequality. In the context of safety and security, one of our biggest challenges is the high levels of household poverty. Low birth registration rates, very high levels of violence against women and children, and limited access to basic services across water and sanitation. So, across our 5 domains, we really have some significant challenges in terms of provisioning at this universal level, especially for the most vulnerable. And when we look at this holistically from a systemic point of view, the overarching challenge is that the underlying system, the national ECD systems, are weak, and we need to strengthen the underlying systems to remedy these consequences that we are seeing. And what I've done in the next couple of slides is looked at a couple of the systemic requirements for a robust, effective ECD system and identified what the gap is that is driving these poor outcomes, poor access and poor outcomes that we are seeing, and what are some of the advocacy actions or steps that we could take to start remedying this in a way that will strengthen the system that will benefit all children, rather than just engaging in small, targeted, localized programs that will help a handful of children access some of the services going forward. So the first requirement for a really robust, effective ECD system is to have an integrated national ECD policy, law, and program, which brings all these pieces together. Often, as I mentioned earlier on in the presentation, is that countries do not have this integrated ECD policy, law, program, which makes it very difficult to plan and to hold role players accountable and responsible. So a very clear step and a very fundamental step is to advocate for a national set of integrated ECD policies, supporting laws, strategies, and programs, which pulls this whole package together, identifies it as a national priority, and identifies roles and responsibilities, and puts in place the necessary leadership, coordination, and accountability mechanisms for it. Without that cohesive glue, that recipe for child development to guide planning across government, it's very difficult to come out with this universalized package at the end of the day. Once we have that integrated policy, we then do need aligned sectoral policies and laws, which mandate services, protection, and support across the 5 domains. And often what we see is that there are sector policies and laws that are either missing, the laws or policies are not in place to mandate the required action, or where we have those don't align with the integrated policy or the responsibilities attendant on ECD as a rights-based sustainable development imperative, so as to give effect to the responsibilities. And I'll give you some of the examples that we're looking at here. So, for example, some of the laws that we notice are missing would be inadequate workplace laws, protecting responsive care by both parents, inadequate inclusive policies and strategies, and that refers to policies and strategies that guarantee the inclusion and reasonable accommodation, not only of children with disabilities and developmental delays, but those that experience other barriers to access. Inadequate sectoral policies mandating universal promotive care, for example, care for development in the health sector. Inadequate screening and referral mandates. And, for example, free or policies or laws mandating free or subsidized daycare or early education for children living in poverty, or any of the other vulnerable groups. So the overarching recommendation from an advocacy perspective is to review your sectoral policies and legislative adequacy against the requirements as set out in the Nurturing Care Framework. And then to advocate for the revision or the adoption of new policies and laws to fill those gaps. And some of the policies and laws that are missing in many countries would be policies and laws with regards to paid maternity and paternity leave, protection of breastfeeding rights in the workplace, inclusive early education policies and laws that secure early education and education for children with disabilities and facing other barriers, the revision of primary healthcare policies and laws to mandate care for development as core to the package of essential services, the adoption of school early education and health policies that mandate early screening for development delays and disabilities, and advocacy for the adoption of a free or subsidized system of regulated quality daycare and early education facilities in underserviced areas. So these are some of the kind of common policy and legislative gaps that one could really focus and target to strengthen the system going forward. Another systemic requirement is leadership and coordination, and I've spoken about that. So ECD, as we know, is a multi-sectoral initiative that is not led, if it is not led by a high-level multi-sectoral structure with the authority, mandate, resources, and capacity to oversee the national imperative, that national imperative will flounder. And it is often the case that the structures that are established do not have the requisite authority, positioning, and mandate. And the solution there is to advocate based on evidence and your country's own institutional arrangements for an appropriate, effective leadership and coordination structure to oversee and hold role players to account for realization of ECD as a sustainable development imperative. When we look at the programs, a critical requirement is that we have integrated programs at scale that deliver on the 5 domains to reach the most vulnerable. What we see as particularly absent in the context of universal programs are parenting support and education programs at scale that support responsive caregiving and early education in the home from birth, community-based support for feeding, infant feeding, but beyond facilities, and mass media parenting education programs for early childhood development. And the kind of advocacy that one could engage in here is to pilot and advocate for the scaling up of proven parenting support for responsive caregiving through primary healthcare services and other outreach services, community-based support for breastfeeding and complementary feeding beyond the health facility, and mass media education campaigns on responsive caregiving and early education. Probably one of the biggest requirements and the biggest gaps in terms of systematizing ECD is resources. Often we might have these lovely policies, but we lack the human infrastructure and financial resources to scale up the programs and to reach marginalized children. And another challenge when we come to resources is that often resources are directed at corrective rather than promotive services. So we'll see that we sit with a situation where nutrition is not emphasized and we have a number of cognitive and developmental delays as a result of stunting. Yet the money keeps on being pumped into ECD centers rather than trying to balance out the growth of the brain in the earlier years, mitigating the need for high-intensity sort of rehabilitative or remedial teaching effectively at an ECD level. So what we could advocate for here is better aligned qualifications frameworks, human resources development strategies, and financial resourcing strategies to implement integrated inclusive ECD. And we can advocate for the investment of more funds in home-based promotive parenting and early education programs, thus alleviating the need for expensive remedial or protective services. So that is just, the time is very limited. I mean, there's obviously a lot more in terms of the systemic requirements and the gaps that are common across the continent. But I've cherry-picked a few here to highlight what can be done in terms of very concrete advocacy actions going forward. So for us, I think the question then is, how do we apply our collective thinking? What and how should CSOs advocate to drive this ECD system strengthening agenda? What we need to ask ourselves as CSOs is, what is and should your advocacy role as a CSO be? And in order to answer this, you need to start looking internally at your own arrangements. What is your main function as a CSO at the moment, and what fields are you working in? Are you a researcher? Are you a service provider? Are you a funder? Are you a community outreach service? Are you involved in human resources development or technical support? Are you involved in the health sector, nutrition, parenting, early learning, safety, and protection? And then in this context, what are your strengths, assets, and networks that you can draw on to advance the advocacy imperatives to systematize ECD support, as we've discussed so far? And how would you go about doing this? And then to ask, as an organization, what can you do to address some of these gaps and challenges? So moving forward, the question I ask of you as CSOs is, what would your next steps be to advocate for strengthening the identified ECD systemic weaknesses? Thank you very much.
Thank you, guys. Just give me a second. Thank you, Patricia. Patricia is not with us, but we are ready to answer any questions. If you have any questions for Patricia. But as we move on, as you see, Patricia did ask some very pertinent questions. And the next session we are discussing is about what are the advocacy issues that we do want to advocate for ECD in the children's sector. So I'm going to again share a Mentimeter, and I want us to give solutions. I want us to give so what are some of the solutions that we can be able to Just give me a second. I don't know what has happened here. So the question is, what would you want to see in the ECD? So what would you want to see in the ECD as what are the solutions for what are the solutions? What are the policy issues? Because we want to develop, I'm hoping Felicitas is here. We are developing a policy paper on ECD and children in Africa, and we want to get from you, especially from the Eastern Africa, what is your take? So just go to Mentimeter and please try to give us some of the solutions. So I'm going to go to Mentimeter and see who is responding. I'm going also to share the screen here on the Mentimeter. So you go and please, what are we going to do on this? What areas we are going to advocate for in our countries, okay? And then the next question is, what can be done to better advocate for ECD? So I would want us to go and please respond so that we can be able to this is going to help in our development of the policy work based on all this conversation that we have done. We don't want this just be a training. We want to be a training that is empowering you as our members, and also we can be able to have an advocacy document that you can be able to use as a CSO to better advocate for children. Like, for example, you've heard what Patricia has said, that we are lagging behind, okay, in how many goals? Okay, we are lagging behind. How many? We have less than 10 years for the 2030 agenda. Okay, we are we are lagging behind. Poverty is increasing in sub-Saharan Africa. What can we do? And ECD is the key for me. I always say, if you can be able to help one child, change one child's life, you have changed a whole generation. You have changed a whole country. Your development starts by the way we bring up our children. If you can be able to improve the way we bring up our children, you're going to improve the way Africa looks like. So I want to see your suggestions. If you can be able to put your suggestion in the Mentimeter, I've sent the link in the chat box. Please do that. I can see people. I can see we are 62 of us. So I want to see responses. Just go to Mentimeter and respond to the question. It's live right now. We have like 5 minutes because this session is supposed to end at 1 o'clock, and I think we are past that time already. So please, if you can be able to respond. People, I can't see your response. I can't see anyone responding. We are 63 now of us. Please go to the Mentimeter link and let me copy this for you. It's not copying. So you can see this, go to Mentimeter, use this code to join and respond. The way you responded in the morning, please. We want policy policy suggestions. I saw some amazing questions about early childhood and children without parental care, early childhood and children children living with disability, early childhood and corporate world. I saw a very interesting question. What can we do to hold governments accountable? Mothers are supposed to stay home. Children are supposed to be exclusive breastfeed for 6 months, but mothers are forced to go back to work as soon, maybe as they give birth, 2 weeks, 3 months. How are you going to do exclusive breastfeeding when you are not at home, you are working? Okay, because the employer has not given you time to go and be a mom, okay? That juggling, okay? Those are policy issues that we need to suggest, and we need to give recommendations, not only to governments and AU, but also to the corporate world. So I want to see those suggestions coming in. I'm waiting for them, my people. As you continue responding, I'm going to invite back Ben to come and give us, to wrap up this session, and invite Madam Amelia to give her closing remarks.
Okay, thank you, Jenny. And perhaps you refresh that link, because we have been responding, but it is still bringing one question. I don't know whether it has just been on my side alone, but it is not taking us to the next question. Generally, I like to appreciate the rest of us, starting with the panelists, AfECN team, for this very, very insightful training on ECD. Actually, some of us, we thought you cannot be a child rights expert if you lack some information or some knowledge on early childhood development, because that is where children start, as it has been presented here, from conception. And there are many other things that we lack, the knowledge out there that is rich to us child rights workers or child rights actors in the CSO world, that we need to tap into. And I really appreciate UNICEF and AfECN to be part of this good, noble idea of training our coalitions from each region to this ECD. And I believe this will be replicated down and cascaded at national level to the grassroots. And the next steps is to have now the CSO come up with an advocacy roadmap or an advocacy strategy for this inclusion of ECD, especially at the committee where we engage much. But this can also be replicated at the commission, because these are the focus work together with the governments, keeping the governments accountable. So in this case, we will have to come up as CSO Forum with our advocacy plan, that all these issues that we have discussed and presented here, how are we going to include them during our CSO forums and our advocacy work at the committee? We have to have a paper on the ECD and what are the advocacy gaps that need to be included. And all these issues have been addressed here, quite interesting. And I think going forward, this is what we'll have to do from all the regions, so that in our next, say, CSO forum, this is the developing, we have a good plan that from this training, it doesn't just end at a training level. As we work at our national level, we are also going to look at what are the issues, what are the gaps. We have talked about a raft of issues around children with a disability and children who are on streets and all that. What are some of these issues that we need to keep our countries or our governments accountable? As they submit their reports, are they including children, early childhood development? For instance, I can say in my country, Kenya, and someone noted during in the Q&A that the government has left this function to the county governments. I don't remember at no moment or at any moment did the government of Kenya ECD, whether the ECD was a national government function. I just saw it being taken to the county government, or it was like the national government is just taking that function down to the county government so that they know what they do with it. But it didn't have a plan on ECD. So these are some of the advocacy issues that we want to address, in as much as the county governments are coming up with their own way of ECD to address ECD. But again, there are a lot of gaps that are there because they are just doing some, they think it is in their own volition. So all these aspects need to be taken, to be looked into, including the advocacy framework that will perhaps be designed according to each country in the region. Then we look at the regional approach. At that juncture, I'll request that because we have another session in the afternoon and the West Africans were calling for preparation, I'll bring in our colleague, I don't know whether Chengetai or who is around. If not, I'll bring in my sister Felicitas, if you're around, to introduce our chair to give her closing remarks. Thank you very much.
Thank you so much, Ben, and thank you once again, the African Childhood Network, for provided throughout these regional meetings, regional trainings. This is the third, and we know that at some point it gets tiring. So we really do appreciate it, Marinza, Patricia, Dr. Thomas, and Stella and Alicia. We really do appreciate the technical side that you are providing for the expertise in the training. Thank you so much. And a big thank you to all the participants that are on the call, that are in the meeting. We know that when it gets to this time of the year, that's when organizations really start working in earnest, and we really do appreciate that you could take time out of your schedules to be with us here. And we hope that the knowledge and the skills that we got today, we would be able to put to use, and that once the presentations are shared as well, that we'll also share it as wide as we possibly can, so that they can also benefit other people that we're working with, but also that they can change how we do business, both in practice in terms of the interventions that we're providing, but also in terms of facilitating advocacy at the regions that we're in, at the countries that we're in, to change how ECD is viewed at country level. And ensure that we can now have proper, now understand from the training that the first 100 days, but over and above that, it's something that can benefit the country, the region, and the continent as a whole, as we seek to be developed and as we seek to ensure that African lives are improved. Having said that, Madam Chair, won't be joining us today, and probably tomorrow you would know that she speaks Portuguese, and we had unfortunately forgot to cater for Portuguese throughout. We catered for it the first day, so that it's going to be a bit difficult. So I'll be standing in at all the trainings for giving this closing remarks. Once again, thank you so much. Let's take the discussion forward, particularly around how we prioritize issues that need to go into our advocacy position paper, because we hope that once all of this is done, we can have a position paper that can be used by all civil society organizations to advocate for ECD at country, regional, and continental level. But that as we do that, we have a standardized message in terms of what is our policy ask to the different stakeholders that we'll be engaging with. So continue having the discussions, the dialogues, even with colleagues that are not necessarily in this training today, so that we can collectively map up what our priorities around this issue are, and that we can ensure that these form part of the position paper. You can reach out to the team that is on this call. We do have your regional platforms. We have your country focal persons. So you can channel that priority areas or any other discussion with them. So that it forms part of this position paper. Thank you once again. Have a good afternoon. For those that are coming back for the 2 o'clock session, it's already going towards 2. Have something to eat, and then we meet in the next 30 minutes. Thank you so much. Bye-bye.